as a outpatient center in communities, we hope will be sustainable and scalable, will happen in multiple locations. And I think that's the very important thing from a public health policy perspective. The world needs models that are sustainable and scalable. It doesn't need individual centers of excellence and then nonsense elsewhere. And I think that's very important.
In fact, one very important trend which is now happening, when you look at medical insurance sector itself, today it is typically providing insurance coverage only for inpatient treatment. But the new generation insurance companies, medical insurance companies, realize that that is not necessarily the best way to do things, because the patient pays more money, the time taken is a lot more. Dr. Krishnamurthy told very early in his talk about how primary health or intervention at an outpatient basis, both for primary and secondary health, as well as for many of the other serious ailments, can be done on an outpatient basis. We truly believe the medical insurance sector would receive such initiatives in a very positive spirit, because it helps them to reduce the overall claims ratio that they experience.
Doctor, joint pain, back pain, Ayurvedic best and English one.
ரெண்டுத்துலயுமே ஆப்ஷன்ஸ் இருக்கு சார்.
எது பெஸ்ட்?
பெஸ்ட்னு சொல்ல முடியாது.
எனக்கு பேக் பெயின் இருக்கு.
For each person, I would suggest you try both, or you try a combination of treatment.
ரெண்டு மட்டும் சாப்பிடலாமா?
ஆமா. ஈச்சுக்கு ஒரு ரோல் இருக்கு. Both have a role. Pain killing, for example, is something that modern medicine does well, but that's only temporary relief. But when you're going through a treatment, either physiotherapy or Ayurveda, believe me, in the beginning you'll have a lot of pain. So you're going to need, ideally, a little bit of help from both. And that is what we
give an example. In the presentation, there was sir, after this, you should come and have a consultation. I think you have a back end. But the thing is that if you look at it, if it is in an acute phase, at that point, when you're really in bad pain, perhaps you'll use modern medicine. Prior to that, and after that pain is over, getting to that root cause and figuring out how it can be done. In case allopathy cannot do for that condition, backache is not an example, but that Ayurveda can.
How many such joint punctures do you have other than Chennai?
I think
we have just initiated. This is our first partnership.
For both of us, this is the first
partnership.
But I think as models, Tejas is based on a partnership model by itself. In the sense, we bring in the best partners to work with us. But in terms of a true joint venture where we're coming together, not just to work under one roof, but to actually build things together, processes and programs together, this will be the first for both of us. Definitely.
Most of the allopathic medicines, they have got serious side effects. How about in Ayurveda?
Well, actually, the thing is that the correct answer to that would be, if it is a medicine, there has to be, it is a medicine because it has to have some impact. So there will be some other effects also which typically may happen. But the side effects often comes because of probably inappropriate prescription. So what we believe in Ayurveda, since your question was directed to is there side effects in Ayurveda, what we expect our doctors to do is to follow a very strict process through which the diagnosis is arrived at, and then prescribe the medicines, and only based on the evidence which is collected. So the chances for that wrong prescription to happen are minimized. Ultimately, there is a doctor's judgment. But we bring in accountability because another person can see the evidence based on which the prescription is done. But typically, to answer your question, Ayurveda medicines which we use are 99% herbal medicines, which are not, even herbal medicines, if you have wrong medicine for a particular condition, can have a side effect, but it is not as bad.
Just to clarify the side effect thing, it's important to recognize two things. One is that yes, all medicines can have side effects, but the vast majority of side effects are non-serious side effects. It's very rare that a good medicine which has gone through all the trials will have serious side effects. The second thing to remember with this is the fault often lies on both sides. A practitioner can make errors in prescription, of course, and we have to acknowledge that. We are human after all. But very often, people make errors in how they take the medicine also. I mean, I have patients, for example, I have told them take it for 3 weeks. They'll come back to me after 6 months, and for 6 months they have been taking the medicine. So the responsibility on the individual is to follow the prescription and to continue to take advice appropriately. There's one other responsibility. When I give someone a medicine, I have no idea how they're doing. They should keep us abreast of the side effects. That's very important. What sometimes people do is that they don't inform about the side effect at all. Then we have very poor record keeping in India. People either don't have records, or sometimes just so that I don't know who they've seen before, they won't bring their records for the consultation. The first time they come, they pretend as if it's their first consultation with the doctor. They think that they're doing themselves a favor. In reality, I would definitely like to know what treatments they've had, what's worked, what's not worked, who gave them what combination. I don't get it. And finally, the reason for side effects, I must tell you the scientific reason why side effects happen. A good drug is supposed to have an effect in a particular part of your body. So let us say, for example, you have joint pains. The medicine is supposed to work in the joints. But the medicine is not smart enough or intelligent enough today to work only in the joint. It works everywhere. That's why you have side effects. The same medicine is working in the skin, it's working in the blood, it's working in the bones, it's working in so many other parts of your body. Hence you have side effects. The next generation of drugs are what are called designer drugs, which will work where they are supposed to work. But that has, except very few exceptions, we don't have such drugs available today. So the moment you have drugs which work only in their targets, you will find that the number of side effects come down. But I must tell you that side effects are manageable. Remember, there are multiple million medical prescriptions every day that happen around the world. The number of adverse reactions are very small in comparison. As a proportion of the number of interventions, the number of adverse reactions are very small. But we only pick up those, always, because that's news. I mean, if dog bites man, it's not news. Man bites dog, it is news. So like that, in the same way, when you get a side effect, you pick it up. And that becomes news. So it's very important that we see it in context. Most of modern medicine, which has gone through good clinical trials, because millions of dollars are spent world over, which has been through rigorous processes, is safe. Otherwise, it would not be approved by FDA. It would not be out there for you to buy. Most of modern medicine. The only exception is when somebody has broken the rule and made a spurious drug, or there is something unscrupulous going on in the middle.
Many people, the medicine have effect at all. They have side effects or not.
In fact, that is the wellness component. We are expecting the medicine to do much more than it can. The medicine can relieve your symptoms. The medicine by itself, in many situations, I won't say all situations, the medicine by itself can't restore the quality of your life. In fact, that's the purpose of a place like this. That to go from medical care to restoration of quality of life, so that you get back to normal function at the end of your treatment.
Doctor, emergency suppose with some dengue fever, they are suffering the way. So best hospital go to best and go to best.
Emergency, if the person is really ill, the hospital is always a better place. But if you are having symptoms like a fever, or if you are having
A mild heart attack, let's say, to go to hospital or
you don't know whether it is. You have chest pain, you don't know what the cause is. There are certain symptoms which are usually best managed in a hospital. Chest pain is a classic example. You don't want to take a chance by fiddling around, because the time lost, there's the golden hour, both for chest pain, for stroke, for many conditions. So when you have a new symptom which is worrisome, sudden onset, you've never had it before, a hospital is often a better place to be. But for long-term care, let us say you've been 3 times to the hospital, your ECG is always normal, you've had a treadmill test, it's normal, your echocardiogram is normal, and your cardiologist has told you it's nothing but you getting excited, you're having gastritis, then of course this is a much better location, because there's only so much they can do for us. Thank you very much for your time and patience and interest. Thank you.
Thank you.
Please do join us for tea.
You were a picture.
Gayu? You see here,
Yes.
Part of this,
Very much.
now we said everything arranged.
We are now ready to start.
From Monday.
Sorry, it's not at all so late.
Thank you so much. I thought I recognized the car. Thank you.
I'm good at it. Thank you.
Thank you for all the help.
I do.
I'm discussed with father and I have a few ideas on this.
Very good. We'll come and take your advice.
Thank you so much, Ashok. Yeah. Then you'll come up with something.
Second one is please listen to me. The doctor
Think it is something.
My God, I would like to contribute something.
Thank you. Yes.
Thank you. Thank you.
Thank you. Thank you. Thank you.
One second.
there was a time. But it's just a picture, a video.
Video. Oh, he's trying to take a still also.
When and where. In Delhi, a lawyer is called Nayyar.
I'm not too sure whether they really mean.
It's a Freudian slip.
He's known by them.
Okay.
Thank you so much.
At
least the copy of the video. Because just had
I was saying in Kerala.
Yes, I did.
Kerala,
Outstanding.
Team, yes.
Yes.
Just 1 minute. Can I give you this?
Yes.
Come. Join this.
Doctor.
And Thomas.
Wind the lamp.
Okay. Come here.
Little bit closer. Yes. Sit ease. Yeah, that's
1 second.
your camera is coming inside.
Thank you.
Something. Today was a terrific shake hand that we did.
Absolutely.
Good one. Yeah, I think long ago. Yeah, absolutely.
Where's the doctor? Come here, please.
Sergeant, come first. Come join this. ஒரு ரவுண்ட் எடுத்துட்டீங்களா பரமேஷ் விட்டு வந்துட்டீங்களா
இது
தேங்க்யூ
இது அனுப்பணும்.